what's your diagnosis?
I'm drunk.
Not you, other doctor.
Oh my goodness. Face transplants, dying feet, and extreme roadside procedures. Today we are breaking down and reacting to the dramatic medical scenes and dire injuries from The Good Doctor. All right, let's dive right in.
Stop!
I'm gonna call 911.
Oh, car accident, okay.
Hello.
Do all doctors get out of the car and run to a car accident? Probably not. There is something called the Good Samaritan Law, but then again, you still have to kind of be aware of the situation that you're putting yourself in.
I'm Dr. Sean Murphy. Where are you hurt?
It's my hand.
If the patient is safe, get away from the vehicle. You never know what's going to happen.
Fourth and fifth fingers are broken. If you have no other injuries...
Sean! Over here!
I mean, it's pretty good. He had like some basic stuff in a bag. I do carry basic medical supplies in my car. Good that somebody was able to check the other car. We always ask EMS, what does this scene look like? We want to know how much intrusion there is of one car into the other or metal into the car.
My chest hurts when I breathe.
So wearing a seatbelt, airbags.
Tachycardia and your jugular is distended, which are signs of a cardiac tamponade.
The heart rate's going fast, jugular venous distension, meaning so your jugular veins are here, and if they are sticking out, you have cardiac tamponade, meaning that there is a lot of pressure around the heart due to fluids.
What are you gonna do with that?
Subxiphoid pericardiocentesis. An echo-guided one would be better, but I don't have a J-tipped wire or an echo machine.
There we go. Typically when we do these in the emergency department, and because of technology, we can do them under ultrasound guidance. In an emergent situation, when somebody's already potentially dead, you're doing CPR and you're trying to revive them. So it doesn't happen that way. Obviously, this is a show, but you literally are snaking it right underneath the xiphoid, okay? It was going up into the left shoulder of the patient, but he was going in a pretty deep angle in the sense you probably go a little bit more 45 degrees versus he's a little bit closer to 90 degrees. And you would do it actually quite slowly until you saw blood starting to come out.
We've kept your daughter on life support because
What does it mean first to be kept on life support, right? Typically that means somebody is on a ventilator machine, meaning that they are intubated, they have a breathing tube going through their vocal cords and the machine is breathing for you. And then typically you're also getting hydration as well as nutrients.
Ask about organ donation. You want her heart?
You decide, okay, do we continue to leave somebody on life support? Is the patient brain dead? And then having the organ donation conversation as well, which is always difficult.
And we just received permission from her next of kin.
We use fancy terms like next of kin outside of like family members. Next of kin is the individual that can make decisions for that person since they're not able to. What you see right there is a internal fixation, but like an external fixator. The ability to move and shift the bones, especially since the bones might have been so displaced that you couldn't have them sit the way that they are. So they will put pins and rods and then be able to adjust them. Facial transplants, very difficult. It takes a very skilled surgeon or multiple surgeons, especially relating to the blood vessels and the nerves.
Proximal facial nerve isolated and dissected.
Okay, let's start the heavy lifting.
So heavy lifting meaning probably lifting off of the face of the donor versus the face of the recipient.
Clamping the left and right common carotid arteries and jugular veins.
Basically clamping off all the blood vessels going to the major arteries going up. Typically we wouldn't do that because when you feel for a pulse, you're always taught you only feel one pulse in the neck at a time because you don't want to decrease blood flow to the brain by compressing both down. So this must be the donor to where they don't have to unfortunately worry about that. Whoa, I mean this is good graphics. Wow. They're just removing the skin, the nerves, the blood supply of the face, one big piece, to put it on the other individual, meaning that the bone structures underneath of the other individuals are most likely intact because of the previous surgeries that that person has already had.
Yes, calprostadol is the same drug as PGE, but in a different concentration. We need to run the IV.
I love it. I've done the same thing where you run it into like the supply area to get all the things that you need. But typically we can put an order in for the procedure that we're doing, and then an emergency medicine tech or an ER room tech will grab everything that we need.
At 0.056 milliliters per minute. That will give the baby 0.1 micrograms per kilogram per minute. Pushing 0.1.
Wow, that's a lot of math done really, really fast. We have a pharmacist that really helps us with this stuff, with the numbers, because it gets quite complicated, how quickly to push it. There are also machines in the emergency department, those IV machines where you actually put the med in the machine, put the exact dose, and the machine actually helps calculate how fast it needs to run.
Restarting compressions.
You're letting the medication work, but it's got to circulate. So to be able to have it circulate, you need to continue to do CPR and compressions.
Pulse not palpable.
No, push 0.2 of the solution. Restarting compressions.
Dr. Murphy.
No, push 0.2.
Dr. Murphy, the baby's flatlining.
No.
There's nothing more
No,
we can
I
do.
can save her.
Sean.
People in medicine feel like we can get everybody back. And so when you can't, you know, it's a huge emotional pull on yourselves, and people handle it differently.
We just lost a baby because this hospital wasn't prepared. The medication we needed was expired. All of it. No backup batch.
Expired. Expired. Expired.
And the question ends up being, can you use expired medications? Well, unfortunately, here in the United States, you're not allowed to do that. But we do know, and we've had conversations about this, that, you know, even though a medication is expired, does the efficacy of that medication totally disappear? Probably unlikely, but they typically don't do studies on expired medications to see if they continue to work. Got a blue foot.
Okay, doctor, what's your diagnosis?
I'm drunk.
Not you, other doctor.
Oh my goodness. Maybe for this individual's sake, it's good that they're a little bit intoxicated or inebriated and their senses are a little bit off, because that foot looks like it's going the wrong direction.
Well, given the degree of the rotation and the fact that the brake is almost compound.
So I hate when in TV shows they use the word compound. We don't use that word in medicine. We use comminuted.
I say we're dealing with a bimalleolar or trimalleolar.
So a bimalleolar or a trimalleolar fracture, what does that mean? So you have your medial and lateral malleoli, which are basically, the medial is the distal end of the tibia and the lateral is the distal end of the fibula. And so when those break, we call those a bimalleolar fracture. And when there is a break to the posterior aspect of the tibia as well, we call it a trimalleolar fracture, which basically just means that the ankle is no more attached to the lower extremity and it's free floating and bad.
Fracture.
Very good. What else? Color?
Pallor, no pulses.
Blood flow is restricted. His foot's dying.
Oh, no.
I'm gonna have to reset it now. Hold his leg.
So good. So exactly what we just talked about, that you need to put it back in alignment because of the way it's positioned or the lack of flow.
No.
No, it's okay.
No.
This is just gonna take a second. I need you to count to 3.
So quick, massive movements we do not do in the emergency department. We try to do things a little bit slower using physics, not using brute strength.
1.
1, 2.
So we typically don't do that fast. You can, but we typically don't. But you can see that there's much better alignment. So you distract or you pull down to basically disengage it and then need to rotate it back into place. Obviously, they would have already had x-rays to know exactly the positioning. You splint it now, you dorsiflex the foot, basically meaning pushing the foot more forward towards him, and then you splint it in this position. So The Good Doctor, I actually really enjoy because they do show good medical cases. They discuss the medicine really well. Also, check out my new supplement company called Life Happens. So if you guys enjoyed this, definitely check out this playlist right here. Binge watch everything for me, please. It helps the channel. And as always, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.